do you think it reflects a deeper, I know this is a loaded question, but does it reflect a deeper systemic devaluation of Black women's well-being?
Well, yes and yes. And I'll say that because women are already at a disadvantage in the healthcare system. We're already blown off saying, like, you know, it could be like a mental health concern. You're having a panic attack. It's just your uterus. But then take that a step lower. And then if you're a woman of color, you don't even get the same, I don't even know what the word is, but you don't get the same respect that a non-woman of color would get, right? Like you're now a peg lower. So now you're complaining. Now you're drug seeking. Now you're just demanding things that you are not entitled to, which you wouldn't be entitled to as a woman, but now even less so because you're a woman of color. And I don't want to say this is about race, but I have a colleague who presented to the same hospital that I did in the same year that I did. She's white. And she said, you know, like, I didn't want to go to my local hospital because I know wait times are shorter here. So I drove 30 minutes to this hospital. She was like, I presented at 8 with right lower quadrant pain. She's like, I was pretty sure what it was. So like I told them all my symptoms to make them say, okay, this must be her concern. She said by 10 o'clock, she had a CT. By 12 o'clock, she was admitted and had her surgery. She said she actually tried to leave and they wouldn't let her. So she presented at 8 o'clock to the same hospital, and by noon, she was admitted to have her surgery. And I presented with same right lower quadrant pain and like no imaging, and was discharged, and nobody tried to stop me when I left, and then ended up having to come back. And I posted my story on Ona's F word page, and the comments that I read, people were saying like, oh, this is just the state of the healthcare system right now. It's not about race. This is what's happening to like all of us. And I'm like, but it is about race. And nobody is seeing that. I'm just like, just because we both had to wait a set period of time doesn't mean race is not a factor. If somebody waited 2 hours and the other person waits 12, that seems pretty discriminatory if they're presenting with the same complaints, right? Especially at the same hospital.
Yeah. And I would say that's very alarming coming from a nursing page, right? Where nurses, I would say that 9 times out of 10, the people, or, you know, I'd say 9.8% of the time of anyone commenting there is